Newsday continues here on One News Now. I'm Riza Diaz. A PGH official confirms that there were no casualties or injuries sustained from the fire that hit a part of the hospital early this morning. According to Dr. Jonas Del Rosario, the fire began at the third floor of the PGH Central Block, where its operating rooms, sterilization area are located. He added that there were no patients where it started, but those on other floors had to be evacuated due to the smoke. Several evacuated patients have also been transferred to nearby hospitals. Del Rosario also said that admitted COVID-19 patients had to be evacuated and are currently staying in the emergency room of the hospital's OB department, while the hospital's supply of COVID-19 vaccines were not affected by the fire. Because of the blaze, the hospital's emergency room will be closed in the meantime and hospital admissions halted. Officials have yet to put an estimate on the cause of damage from the fire. President Duterte has appointed Major General Andres Centino as the new chief of the Philippine Army. Centino replaces Lieutenant General Jose Faustino Jr., who was serving as acting chief of the Army after Lieutenant General Sergito Sobejana was promoted to AFP chief. Centino graduated from PMA Maringal class of 1988, the same class of newly minted Police Chief Directorial Staff Lieutenant General Donardo Carlos. He previously served as commander of the Army's 4th Infantry Division covering northern Mindanao, where he was known to be keen on hunting down communist rebels. He also served as AFP Deputy Chief of Staff for Operations. Senator Ping Lacson commends Malacanang and the Defense Department for upholding the rule of law for naming a new Philippine Army chief. Lacson said that the appointment of Andres Centino replacing Jose Faustino Jr. for the top Army post complies with the Section 4 of the RA 8186. Lacson earlier questioned the appointment of Faustino as Army Chief as it is against the law, which prescribes the officer grade distribution in the active force of AFP. The North Luzon Expressway will implement higher toll fees starting Tuesday, May 18. NLEX will collect additional 2 pesos for Class 1 vehicles, 3 pesos for Class 2 and 4 pesos for Class 3 in the open system. The open system, where a flat rate is charged per entry, includes Quezon City, Caloocan, Valenzuela, Navotas, Maykawayan, Marilao, and Bulacan. For end-to-end travel from Metro Manila to Mabalacat, Class 1 vehicles will pay an additional 6 pesos, while Class 2 and 3 will be charged an additional 14 pesos and 16 pesos respectively. The Health Department is seeking to intensify its contact tracing effort. This as some close contacts of those 2 OFWs with coronavirus Indian variant also test positive for COVID-19. Faith Del Mundo with the details.
The Health Department strengthens the contact tracing of the 2 individuals who had contacted COVID-19 with an Indian variant. Still, the agency is still searching for other close contacts of the passengers. With the airline's coordination, DOH has traced 2 individuals and found that according to the flight manifesto, there are 41 passengers who may be considered close contacts.
So nakita na ho namin yung manifesto nitong flight details nitong dalawang OFWs at katulad nga ho ng nai-report namin for the case 1 which who is the 37-year-old male from Oman, meron ho siyang 6 na close contacts doon po sa eroplano. 3 po sa kanila nakita na namin sa database ay PCR negative.
According to Health Undersecretary Maria Rosario Berhere, authorities are still searching for the other 3 close contacts since the name on the manifest did not match.
As to the case number 2, which is the 58-year-old male from UAE, meron ho tayong verified na 32 close contacts with dun po sa eroplano. 3 po sa kanila ay positibo. Pinasubmit na ho natin sa whole genome sequencing yung isang sample at yung sa 2 po ay hinahanap pa ho natin yung mga nilolocate po natin, yung mga specific individuals.
Berhere says the rest of case number 2 close contacts have tested negative. Meanwhile, Berhere maintains that the country's vaccines wastage remains under the acceptable 5% and urged LGUs to prepare generators in case of power interruptions to ensure the integrity of vaccines.
Doon pa rin tayo doon sa ating target for wastage, no, which is just less than 5% sa ngayon. Nakikita po natin na ang mga probable lang, no, katulad nung isang beses may nag-brown out po doon sa isang area natin at nasira po itong mga bakuna. Pangalawa po, yun pong mga kapag binuksan, nakikita na may mga parang contaminants na yung bakuna. Isa rin po yun sa nakikita natin. So para po maiwasan, we have already advised our local government units, ang implementing units natin, to make sure na meron po tayong standby na generators if ever, no? Especially for those areas na madalas po na nagba-brown out, para masiguro ho natin yung potency ng ating mga bakuna.
The Health Department is also now investigating an incident in Cotabato City where a freezer where vaccines are stored was reportedly not switched back on after a power outage. Berhere also reiterates that COVID vaccines should be stored separately from food, amid reports of LGUs contacting food chain suppliers to store the vaccine. Meanwhile, Berhere assures the public that all vaccines currently available in the country will be used well before their expiry dates, and that the country will not accept near expiry or busted vaccines.
So wala pong dapat ipangamba ang ating mga kababayan. Ang mga tinatanggap po nating bakuna ay ligtas at within the expiry date, no? So hindi po tayo tatanggap ng mga expired vaccines already at hindi rin po natin ipapagamit sa ating mga kababayan kung expired na ang bakuna.
For News 5, Faith Del Mundo, we are One News.
Israel strikes Hamas Gaza chief Yehia al-Sinwar's home as the Islamist group fired rocket barrages at Tel Aviv early Sunday morning. This is the 7th day of hostilities and both sides are showing no signs of abating. Reuters reports that at least 3 Palestinians were killed in the Israeli strike and many are injured as bombs bombarded the coastal area of the enclave during the night, while around 10 Israelis are injured as they run for shelter. Now, at least 148 people in Gaza, 41 of them children, and 10 Israelis, 2 of them children, have been killed since violence began on Monday. United Nations Secretary General Antonio Guterres says he is dismayed over the civilian casualties in Gaza. Guterres said that he was disappointed by the increasing number of collateral deaths among civilians and children as a result of an Israeli airstrike last night. He said he was also deeply disturbed by Israel's strike on a building of international media outlets, including AP and Al Jazeera. Israel's bombing in the Gaza Strip continues for the 7th consecutive day, leaving dozens of dead and destroying residential buildings. The spread of COVID-19 has brought numbers and statistics to a forefront and the daily lives of millions of Filipinos. Now, more than ever, data has become an important factor in analyzing the pandemic trends. But what is data telling us about the spread of COVID-19 around the world? The World Health Organization answers that in this video.
Hello and welcome to Science in 5. I'm Vismita Smith and these are WHO's Conversations in Science. Today we're talking to Dr. Oliver Morgan about the trends that we are seeing around the world for COVID-19. Welcome, Oliver.
Thank you very much, Vismita. It's a pleasure to be with you.
Oliver, what is the data and science telling us about COVID-19 transmission and the picture around the world?
Well, Vismita, we're seeing quite a concerning picture. Throughout the months of March and April, there has been a steady increase in the number of cases each week, and the weekly number of cases is now higher than in any time in the pandemic. We've also seen that the number of cases in younger adults and children might be higher than in previous periods of the pandemic. We think overall the increase in cases and the higher number of cases in younger people is due to 3 factors. One is because of changing adherence to public health and social measures and resulting in increased social mixing. The second might be due to the circulation of new COVID variants that are more transmissible. and the third is because of uneven or unequal distributions of vaccines.
On vaccines, Oliver, could you please give us what is the picture that's emerging as more and more countries are vaccinating? What is data telling us?
Well, we have good information from scientific studies that individuals who receive a COVID-19 vaccine are at lower risk of severe disease or death. We've also seen that several populations that have achieved high vaccination coverage, often in older age groups, have seen reduced transmission in those age groups. However, not all populations have been able to achieve high vaccination coverage, and we still see circulation of COVID-19 in all age groups, and especially in the younger age groups who are not vaccinated. For this reason, it's very important that we all continue to adhere to public health and social measures to reduce the occurrence of transmission of COVID-19.
So, Oliver, based on the trends that you described and the picture that you just painted, what is the way forward for us in this pandemic?
Public health and social measures are an important part of what we all must do, even though people are getting very tired. Public health and social measures include a number of different actions, such as wearing masks, maintaining distance between each other, washing our hands frequently. When we do need to meet, it's important that, where possible, we meet in places with good air circulation. And also importantly, when we do have the opportunity to receive a vaccine, we take our vaccine when we have that chance. So an additional factor that we must also continue to focus on is making sure that we have good surveillance and good laboratory testing so that we know where infections are occurring. This allows us to adjust the public health and social measures as needed. And these must be done along with good contact tracing, treatment and isolation also for all populations. It is also important for us to keep investing in science, both on vaccines, but importantly on treatments, as well as laboratory tests for COVID-19, so that we can improve our interventions as we go forwards.
Thank you, Oliver, for explaining the science and especially telling us about the importance of investing in science. Until next time, then, stay safe, stay healthy, and stick with science.
LA Lakers legend Kobe Bryant was inducted to the Naismith Memorial Basketball Hall of Fame. Bryant's widow, Vanessa, offered an acceptance speech on his behalf as presenter Michael Jordan stood nearby. In her speech, Vanessa notes that she always avoided praising the five-time NBA champion in public, but now commending him for his accomplishments on one of the most public stages. The night ended with Vanessa gracefully honoring her husband and speaking to him directly. The Hall of Fame induction ceremony was delayed for months due to COVID-19 pandemic. And those are the top stories of the hour. Join us later at 2:15 in the afternoon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.